What's up YouTube? What is going on? Back here with a new video today. And in today's new video, what we're going to be talking about is why it's important to monitor and watch your foot and neck position if you're someone that deals with lower back pain, specifically if you're someone that has sciatica or if you have disc-related issues that is causing maybe sciatica. So what I'm going to be talking about and showing you guys is why people's pain may become worse because of them not being aware of their neck and foot or leg positioning. So firstly, and now I can specifically relate to this as well because this was a pain trigger for me, or at least made my pain worse, is that when I would sit and if I ever put my neck into cervical flexion, so if I show you guys from the side here, if I bent my neck forward here and sat in this position, this would make my pain or my symptoms worse when I specifically had pain. Now at the same time, if I were to extend my right leg outwards, which was the leg that I had pain going downwards, if I extended it outwards and if I dorsiflex my ankle, so I bring my ankle to my shin here, or basically brought my foot to my shin, this would trigger my pain and it would cause my pain to become significantly worse. So you're probably wondering why this may be and why this is the case for some people and why their pain may become worse. The reason being is, so if we understand when we flex our neck forward and at the same time when we bring our ankle to our shin here and also extend our leg outwards, we're creating neural tension. We're basically stretching the nerve out. And by stretching the nerve and creating that tension, that could cause things to become significantly worse because we may be placing more pressure onto that nerve root from that already herniated or bulging disc. And this is where people's pain may become worse. Now, what I just did actually, right here, by extending my foot outwards, and my leg outwards and flexing my neck forward, this is actually a provocative test known as the sitting slump test, which clinicians may use to maybe diagnose someone with maybe a disc issue or sciatica, or if they have basically problems with the sciatic nerve root. Now, I'm not a medically trained professional. I'm just someone who has dealt with the injury myself, and I'm not advising for people specifically in the strength and conditioning field or sports performance field to be conducting provocative tests. But if I'm working with a client that has lower back pain, this is something that I would maybe want to know or be aware of before maybe performing some sort of more advanced activity or exercise that may make their pain or injury worse. And so this is a provocative test, and I'm not saying that I specifically use this myself, but this is something that can be used to essentially determine if maybe one has problems with the sciatic nerve root. Now, in my personal opinion, I would like to identify this in an unloaded position before we put someone into a loaded position where we're mimicking that same kind of pain trigger, and we do not want that. And I don't want that for my clients or for myself if someone maybe has lower back pain or if I'm kind of working with them. Because at the same time, we don't exactly have to maybe do this specific test. I could maybe just be aware of it from doing a hamstring test or from a hamstring stretch specifically. So if you had an individual doing a hamstring stretch here, and maybe if I had them just bring their toes upwards, kind of to their shin here, and this kind of triggered pain in their back, right away we could have an indication that there's something going on in their lower back, maybe possibly related to the sciatic nerve root there. And this is something to be aware of because we wouldn't want to prescribe hamstring stretches specifically in that case for that individual because we're creating that neural tension, and that is essentially a pain trigger for them. So I just wanted to share that with you guys because when it comes to neck flexion or kind of extending your leg outwards and dorsiflexing your foot, these are specific ways that people's pain can become worse. And a lot of people aren't aware of this. And these are little subtle things, just foot position and neck position. And maybe if you're sitting at a desk, just kind of being aware of that. Maybe you're someone that is constantly engaging in that dorsiflexion or just kind of cervical flexion, maybe at your desk or whatever the case may be, and maybe that's making your pain worse. So this is just something to be aware of. And at the same time, it's not just flexion or dorsiflexion at the ankle or cervical flexion at the neck. Maybe there could be issues with extension, cervical extension as well with people. That could be a pain trigger as well. But the whole point of this video, guys, is that it's important to be aware of your foot and neck position when it comes to lower back pain because these could be two positions or kind of two movements that can make things worse for your lower back pain. So keep in mind, guys, everything's connected. So we have our foot, we have our leg, our neck. Just by altering the leg or the neck in a certain way, that can trigger one's pain. And that's something to be aware of if you have pain and maybe flexion, maybe it's even an extension that you have pain. So it's just something to be very aware of and cautious with, and try to avoid whatever your pain triggers are as much as possible, because if you continuously engage in those pain triggers, this is only going to continuously pick at the scab and delay recovery, and that's not something that you'd want to do if you're looking to make a pain-free recovery. So I just wanted to share that with you guys in this video. I hope you guys enjoyed this video, and if you have any questions, comments, be sure to leave them below. And until next time, I wish you guys all the best and a successful and productive day, and take care.